Hello, everyone. This is Lauren Steiner, and welcome to tonight's special California edition of The Robust Opposition. I was going to do a show about two bills tonight. Well, actually, one is a bill and the other is a regulation, the bill being single-payer health care for the state of California, and the regulation being one that was going to severely reduce net metering for solar power. I was going to do this show on Sunday, but we're expecting a very huge storm here in North Carolina that will very well knock out my power. And even though I have a generator, my Wi-Fi is not on the generator. So I was unable to get the solar person for tonight's show. So I'm going to do the whole show with my guest, Michael Lighty, who I'm bringing into the screen right now. How you doing, Michael?
I'm great, Lauren. How are you?
I'm all right. I'm anticipating this storm and I'm kind of looking forward to it because I think it's going to be like the blizzard of 78 and everything got shut down and we had so much fun. I was in college in Connecticut back then. So now everybody knows how old I am. Anyway, we're talking about California's single payer bill, AB 1400, which I'm just going to move my microphone a little closer here. Which just the other night passed through the Senate Healthcare Committee. It's a 2-year bill, but the author pulled it last year. So basically this year, it's got to go through all the committees in a very concentrated period of time. And it goes to the Appropriations Committee next week. And here to talk about this bill with me tonight is Michael Lighty. And Michael is currently the president of Healthy California Now, which is a single payer coalition in California. And it represents the National Union of Healthcare Workers, which is not the big union. The big union is the California Nurses Association. They have more members. But nonetheless, it's a leader in the national, and Michael, I'm sorry, is a leader in the national DSA, Democratic Socialists of America, Medicare for All campaign. And he serves on the board of People's Action. Most recently, he was the healthcare constituency director for Bernie 2020. And before that, he worked for the National Nurses United as their policy director. And before that, with the California Nurses Association. So Michael, welcome to the show.
Thank you, Lauren. And I guess the weather's a little different from LA out there, huh?
Yeah. But being an East Coast girl, I'm used to it, and I've got all the appropriate winter clothes, and I'm even going to go out and get one of those saucers so I can slide down my hill. We're expecting 8 to 12 inches of snow here, and I'm 3,500 feet up in the mountains. Well, anyway, let's talk about AB 1400. I don't want to get into why we need single payer because I'm sure most of my viewers already support the policy, single payer Medicare for all. So maybe you can talk about the specifics of AB 1400 just briefly.
Sure. AB 1400, known as CalCare, the California Nurses Association have led the campaign to pass it. It is true that it was at the Assembly Health Committee this past week and passed with an 11-3 vote, including the chair of the committee, Jim Wood. It would establish a comprehensive system of guaranteed health care in California, with a lot of the implementation of that system being determined obviously by the financing and also under the control of a governing board appointed by the governor and the legislature. It would require the professional clinical judgment of nurses, doctors, and other medical professionals to be the determinant of the care that people receive. It would establish global budgets for hospitals and medical groups, and it would utilize rate setting and primarily fee for service for the remainder, about 20 to 30% of services. It would negotiate and lower prescription drugs substantially. It would eliminate the fragmentation and waste of the current multi-payer system. And most importantly, it would provide everyone with health care. By eliminating all the co-pays, deductibles, premiums, and other barriers to care. It places a great emphasis on equity in healthcare and the elimination of healthcare disparities, and also on the diversity of the workforce and culturally competent care. It does probably mean that certain practices in California, such as managed care and integrated healthcare delivery systems, would be replaced by a system under the present system that, unlike the present system, that would not rely upon those mechanisms of managed care. It would consolidate all existing healthcare programs at the state level, and as much as possible, allow the integration of the federal healthcare programs. Probably almost certainly Medicaid, known as Medi-Cal in California, and then it would either integrate Medicare or wrap around Medicare, the federal healthcare program for people over 65. And the idea would be that if the legislature were to pass AB 1400 and be signed by the governor, it would initiate discussions between the Newsom administration and the Biden administration over the terms of federal support and resources that would be provided to California's new healthcare system.
That was an excellent overview. And I want to mention too that this time, unlike with Anthony Rendon, when he introduced the bill in 2017, there is a slew of authors. And I think the principal author, Ash Kalra, demonstrates much higher commitment, to me anyway, than what's his name, Ricardo Lara, which I think Ricardo Lara was just using it as a stepping stone to run for insurance commissioner. Because every time I talked to him about the bill, he didn't really seem to know very much about it or be very committed to it. But Ash Kalra, I mean, when you listen to him talk, he is so committed. And I really feel we have a champion. He also endorsed Bernie Sanders.
Yeah, I work with him on the Sanders 2020 campaign. Have a lot of respect for Ash. I understand folks' criticism of now Insurance Commissioner Lara, but I will say it did get through the state Senate.
Yeah.
And we did have, I mean, that's the majority of the state Senate, and we did have a number of assembly authors too. So I think that we have to understand these bills, just like the bills that Sheila Kuehl did in the 2000s, as building upon each other, that we've been at this for a while, and each iteration learns from the last.
Yeah, I'm going to talk about that bill because I worked on that bill in 2004. But before we get to that, I want to talk about this companion funding bill, which is known as ACA 11. Can you describe what it says and explain to the people why it was separated from the main bill?
AB 1400 requires a majority vote by both houses of the California legislature and a signature from the governor. Then it would initiate, as I said, discussions with the Biden administration. Depending on how those discussions go, the policy in AB 1400 might be modified and therefore would have to come back to the legislature. But the key point of those negotiations is the funding mechanism. How much of the federal monies currently going to California for healthcare could be incorporated into the new financing system in California? But because of the specific provisions required of bills that have financing that raise revenue, that bill must be separate from the policy bill. And you can't really finalize the financing until after you know what the federal government's going to contribute. So ACA 11 is a constitutional amendment, primarily because it needs to change two provisions of the California Constitution. One is known as the GAN limit, which limits the size of the of the state general fund. And that limit would be exceeded by the healthcare revenues generated through a single payer financing system, in this case known as CalCare. And secondly, there's a proposition that was passed by the voters, Prop 98, that requires 40% of revenues raised to the general fund would go to education. So those two constitutional provisions must be changed by a vote of the people. Separately, Prop 13 requires that 2/3 of the legislature pass any tax increases. Therefore, ACA 11 needs a 2/3 vote of the legislature and a majority vote of the voters at the ballot. So it is really an acknowledgement that we're not going to get single payer Medicare for all type reform in California until the voters approve that constitutional amendment. And that means, as the AB 1400 says, its policy provisions, with the exception of the governing board and some preliminary work, would not be implemented until the financing is established. The financing mechanism uses a gross receipts tax, gross revenue tax on businesses. It utilizes a payroll tax for workers making more than, I think it's 49,500 a year. And it would institute an upper income tax starting above 149,500. So at increments, it would go from 1% and raise a couple of percents above that for higher income individuals. So that combination of a gross receipts tax, a payroll tax, and an upper income tax increase would provide the monies for the single payer plan in California. I should add, and this is the most important point in some ways, is that, as many economists have said, most notably economists at UC Berkeley, that the current monies that workers in the middle class spend on healthcare is the greatest tax burden they experience. And there are, at certain income levels, really basically middle class income levels, people can pay from 25 to 40% of their income on healthcare. And the recent Gallup poll showed that 30% of people in this country have deferred treatment during the pandemic as a result of healthcare costs. So, unlike the way the media has framed the discussion over ACA 11, in fact, it's the present system that's costly. And what ACA 11 and AB 1400 and single payer in general represents is a savings. So really, if the media were honest about it, we'd be talking about how these proposals mean that we're going to pay less and get better health care. It's not really a cost question, it's the savings question and the elimination of barriers to care.
Well, I'm glad you brought that up because we also have joining us tonight is Maureen Cruise, who is a friend of mine. We fought many fights together when I was living in Los Angeles. And she has been a registered nurse since 1978. She's currently the co-director of Healthcare for All Los Angeles, and she was a public health clinic nurse when she practiced. Welcome to the show, Maureen.
Thank you. Thank you so much, Lauren. Hi, Michael.
Hey, Maureen. How you doing?
I was part of Michael's team on SB 562, as were you, Lauren.
Yes. Well, I go
That's
back
where
to
I learned
2004. And, you know, we've had
Yes.
many conversations about the politics of these bills, Maureen. You may want to lower your computer screen so you have less headroom. There you go. All right, now we're all on the same plane. I'm into symmetry here. I wanted to talk about, 2004 because I did work on this bill. It was called One Care. And you remember George Savage, Maureen. He was kind of leading the effort in Los Angeles. And we used to meet at his house in the Pacific Palisades and talk about strategy. And I remember being like a little spokesperson. I remember going to the Crossroads School, talking to the students there. It's a very elite private high school. And I remember the one question that I was asked by these wealthy kids. They were concerned about the insurance company employees, like what would happen to them if we got single payer. And I really didn't know what to answer. I mean, I just was kind of shocked that that was their main concern. But, you mentioned that it did pass both the Assembly and the Senate in 2004, Michael. But that's because we all knew that Schwarzenegger, who was a Republican, was going to veto it. In 2017, that bill did pass the Senate, which I do think is the more progressive of the two bodies. But then, of course, Anthony Rendon, who was the Speaker of the Assembly, at the behest of Jerry Brown, who said, "Don't embarrass me by presenting me with a bill that I'm going to have to veto," which I find very interesting because I actually worked on his campaign. I was his media advisor in his 1992 presidential campaign. And you guys might remember he debated Bill Clinton on the Phil Donahue show. He was taking the side of single payer. Fast forward to when he's governor, he's like talking about vetoing it. So Anthony Rendon vetoed it. And of course, we did a lot of political action, as you both remembered. there was a big rally where the nurses and all the supporters occupied the Capitol up there in Sacramento. And I happened to go to an event downtown where I saw him there. And I decided that I would talk to him and secretly record this conversation. And this is how it went. And I think if he wouldn't have talked to me like this if he knew that he was being recorded.
For SB562. And I was wondering, what is it going to take for our campaign to persuade you to release it from the rules? What do we need to do?
Oh, that's very easy. We have a funding source, a service delivery mechanism, a mention of the GAN limit, a mention of Proposition 98, a mention of SB 562 is about 17 pages. When Sheila Kuehl wrote a single payer bill, it was 357 pages. So it should not be a symbolic measure. It should be a real effort to have a real impact on real people's lives. That's what it'll take.
But what about the fact that?
No, wait, did you hear what I said?
Yes, I did. And
So
I-
GAN limit,
but
Proposition 98, service delivery mechanism, a mention of the federal waiver as well.
the 18 amendments that were presented to your
No,
office.
they've never been. No, ma'am, they've never been presented in my office. You should ask the Nurses Association if those amendments have ever been presented in my office.
All right,
You should ask the Nurses Association. You're not going to do it though.
I will.
No, you're not. You're not going to do it
Why wouldn't I?
because
I
you're
will.
not going to. Ask the California Nurses Association for those amendments and then send those amendments to my office. That makes it very easy, right? You can send those amendments to my office.
What about the
No,
fact?
ma'am. Are you going to ask for those
Yes,
amendments?
I promise you. I give you my word that I'm
Okay.
going to ask Pilar Shivo about those amendments. I'm going to ask Ken
Okay.
Zimmer.
And you should ask Ricardo Lara.
Ken
too.
is there. Now, what I want to know is that lots of bills are not complete. You know, AB 398 was not complete, and that was rushed through in like 2 weeks.
I don't know what that is.
That was the cap and trade bill that Jerry Brown wanted. You know, Kevin DeLeon did a bill with Wykowski that 50 environmental justice groups supported a cap and trade bill. That never even got out of committee, which Jerry Brown comes up with 398 with all these things written by the oil industry, and that sailed through in the last couple of weeks of the legislature.
Okay.
I heard that was also woefully incomplete.
We'll see if you do what I ask you to do.
I will.
We'll see if you do, okay?
I will.
Can you imagine? Can you imagine he's sitting here bullying me that I should ask the nurses union? But what about that point, you know, like that I made? 398, because I also fight fracking, was a bill. It was a cap and trade bill that Jerry Brown wanted because he's taken $20 million from big oil. And that got pushed through. And that was also woefully incomplete. What did you think, both of you back then, about the discourse that went on about 562? Dave Dayen also wrote an article in The Intercept in which he talked about that. And he also brought out all the dirty laundry of the fighting between CNA and, you know, Sal Roselli's union. And I thought, look, because I'm a journalist in service of my activism, I'm not out to get the scoop, but he was out there, you know, and I thought that was made us look bad. And you might remember that even though Eric Bauman, when he was chairman of the California Democratic Party before he had to resign in ignominy, however you pronounce that word, he was saying, you know, elect me because, you know, I will get you single payer health care. And when I confronted him at a disruption we did at this DNC CDP summer resistance tour, where we disrupted that over single payer health care, I went up to him and I said, what happened? He said, well, we're doing all we can. We're doing all we can, Lauren. He just kept repeating himself. Meanwhile, he told Dorothy Reich, you'll find this interesting, Maureen, to send out Dave Dayen's article to her entire list of 5,000 people, Dorothy being the chair of the Santa Monica Progressive Democrats. So behind the scenes, he was using that article as propaganda against the bill. So before we talk about the prospects this year and the machinations this year, do you guys want to reflect back on 2017? Because you made the point, Michael, that we learned lessons from that, which we're applying.
Right. Let me just say a couple things. One is that when I was at the People's Summit in June of 27, I did a phone call with Anthony Rendon's policy staff to begin the discussion about how to amend SB 562. We told them that we had a financing program, and it is similar to the one that's in ACA 11. Theirs is a little more elaborate on the payroll tax side. And so we were in discussions with his office about that. Secondly, the Dave Dan article, as he himself and his editor said, they did that article without talking to us. They literally didn't pick up the phone and ask our perspective on the issues raised in that article. We were not misleading anyone. And there was an orchestrated campaign to tank 562. And it was behind the scenes, and it was unfortunate. But I think that one thing that the speaker made clear is that he's not going to move a bill until there's a financing plan. And so, to Assemblymember Kalra's credit and to the credit of CNA, they developed one. Once you do that, though, then the press, all they talk about are taxes. And so you have to be careful about in what context you do it. And a cynic might say that the speaker is fine with that. That if the issue is taxes and it upsets the media and the press and it gives opponents something to hang their hat on, well, then maybe that relieves pressure on them. And so I respect certainly the need for a financing plan, but I would much rather have us lead with the savings and put the financing in that context.
Yeah, Maureen, I know you have some comments on that, the savings.
Well, yeah, but also as a lifelong Californian, third generation, Californians have voted to tax themselves repeatedly. Repeatedly. It is a myth to say people don't want to be taxed. We don't want to be taxed for things like bombs to murder other people's families. We don't want to be taxed to bail out banks and corporations that have been doing so much damage to the rest of us. But Californians have repeatedly voted to tax ourselves. And even on things, I mean, that I disagreed with, I remember we had a Proposition 2, it was probably 10 years ago. You remember that? To give out of the general fund, to give 9 hospitals out of the 450 hospitals that we had, to give them extra money, for the children. There were hospitals that, help children, like for the children, except it didn't really give any care to children. It was a construction and remodeling bill.
Oh, I remember this. Yeah.
You remember that?
Yeah.
And but the TV commercial was all about the children. Well, taking money away from the general fund is taking money away from the children who need it the most, right? So, I always say, follow the money on these things. And when there's any exception made, why the exception? Why 9 hospitals, and of the best funded hospitals at that time, by the way? They had the most money. Of course, that's probably why they got, it takes money to make money, right? So anyway, I would just always say, follow the money. SB 562 was amazing to me because it was done in such a rapid fire way, and the materials came out so quickly, and the the Perry study is phenomenal. Anyone that's interested in single payer, what do you think of that, Michael? I mean, I just found
I agree, Maureen.
An awesome study, really.
Yeah.
And and when we talk about taxes, I think we have to look outside of our borders of our country as well. And most the average, this is a couple of years old, so it's more now probably for all of us, but a couple of years ago, I read some research done. It was based on the Center for Medicare and also CIA Facebook, or CIA, whatever they called it, with their information. Anyway, there were these charts, and it showed that in Europe, the average is $4,000, all taxpayer. And then maybe less than $1,000 out of pocket in those countries that do have some out of pocket costs. So their max would be 5,000, like on the average, right? Not per person, but that's what, the healthcare costs per capita in the country. And the United States is 11,000. 7,000 of that is tax dollars. But as tax dollars, we don't realize we're spending. And 4,000 on top of that is out of pocket. So there is a reason the number one cause of bankruptcy in this country is medical debt. And these people in these European countries with the average of paying $4,000 out of their taxes, and they have much better outcomes than we do, they have never heard of medical debt. They don't know what it is. They don't know what a deductible is. And they don't know, for the most part, what a premium is, not the kind of premiums we pay. The Canadians don't know. The Canadians don't know.
Yesterday in the chat of the nurses, the nurses union had a meeting to prepare people to do the lobbying for the bill going into appropriations, which we're going to talk about. They were saying that the average person, the people that'll save the most are the people that are, say, middle income and underinsured. They'll probably save, I think the figure, you can correct me if I'm wrong, Emily, was like between $8,000 and $15,000 a year. The higher income people will save between $5,000 and $7,000 a year. And the only people who will spend more in taxes would be maybe the top 3% of the earners.
Mhm.
So it's a way that we market it. We need to be calling these premiums, copays, and deductibles private taxes. And if we use that terminology, people will understand that we're already paying. So the way I phrase it to people is I say, you know, you will be paying a tax, but your overall bill at the end of the year for healthcare will be less. Healthcare will be free at the point of service, and more things will be covered than have been covered before, not just medical, but mental health, dental, vision, hearing, home care, long-term disability, and even certain alternative treatments. And you won't have to stay in a job or a marriage that you don't like in order to keep your health care. So I think the marketing, the communications of this has to be really simplified for the average person, because we know that the health industry is going to spend mightily, big and mightily to block this. So let's talk about what's happening with this bill right now. So you think that he adequately addressed because he said that he worked with Rendon to deal with the Gand Amendment, Prop 98, and the waivers. You feel he adequately addressed that, so they can't use that against us this year, right?
No, it's in the constitutional amendment. I think what's significant about it is that it requires a vote of the people.
Right.
And so what our movement has to understand and prepare for is a big ballot fight. And that means that the industry is going to be throwing 200, maybe $300 million against us. They did, they threw that around AB 5, right? In the case of the rideshare and gig economy companies, they threw about 161 million against Prop 61, the prescription drug price initiative limitation, right? That Maureen worked on, and you as well. And so that's what we're up against. And so how are we going to inoculate voters? How are we going to prepare ourselves? How are we going to bring some of the folks who haven't made single payer a priority, who are supportive of it? How are we going to tap that 70% of Democrats or 80% of Democrats who support it? How are we going to keep the independents and get a chunk of working class Republicans? We've got to build that coalition. And it's going to get us beyond our comfort zone in some respects. But I think that when you talk about the GAN limit and you talk about Prop 98, you're talking about a ballot measure that's going to have all the weight and might of organized labor in California, because that's the only institution that has consistently won ballot fights, high stakes ballot fights, expensive ballot fights.
Yeah, I mean, I remember Prop 61, and that only, if I remember correctly, only affected like 77%. Because it was only for certain government programs that would negotiate with Big Pharma. And they fought even 7%. But a lot of things like GMO labeling, it wasn't even banning GMOs. It was just labeling GMOs. Now, these are things that poll very favorably before they start their deceptive advertising. I mean, I remember I worked in the mid 2000s on public financing for the Secretary of State's race. It wasn't even public financing for all the races. They picked one little race, Secretary of State, in charge of the elections. That was also popular. It went down. So I'm very concerned. I want to talk about, I want to sort of end with how we organize and how we win this thing. But I want to talk about the impediments along the way to getting it passed by the legislature and signed by the governor, because I'm still a little confused. I have to say, there were a lot of authors, as I mentioned, principal authors, co-authors, a lot of them, and they spoke eloquently at the health committee. But then you have someone like Autumn Burke, who I know to be a moderate Democrat. They call them mod Dems. And in the anti-fracking movement, we call them oily Dems, because they take money from the fossil fuel industry. And also, the fossil fuel and also the utilities.
I have
So
to say,
now,
I don't find that moderate. I myself don't find that moderate. I think that labeling is being way too kind to people who are responsible for the suffering of millions of us. So I think I call them, corporate Dems.
but they are corporate Dems, and Paul Song had a term for that we're not going to mention his term because he got into a lot of trouble for saying it. But I think the three
The
of us.
truth hurts.
What?
The truth hurts.
Yeah. He got in a lot of trouble. He basically deactivated his Twitter account, and he's never come back on Twitter again after that fiasco. But a lot of people thought he was talking about Hillary when he used this term. But regardless, what I wanted to say was, Autumn Burke made some what I consider to be very disingenuous comments about the bill. And I was wondering, Michael, I can't remember specifically what she said, but I was listening to her and thinking, she sounded very hostile. First of all, her tone was very hostile to the author. She made a remark that made her sound resentful of her own constituents. She said, my constituents are bombarding me to support this, So she said, and I'm going to vote for it now, but I'm not promising that I'm going to vote for it in the full assembly. And that kind of worried me because Chris Holden is also a mod or an oily Democrat. And he is chair of this new committee, the Appropriations Committee, where all good bills go to die. What they do is they put them in the suspense file, which is essentially kind of killing them. And I'm kind of worried, and I want to know your opinion, if you think that Chris Holden is going to be this year's Anthony Rendon, and he's doing the bidding of Newsom. Or if you think it can pass, and like you said earlier, Michael, that you really think the big battle is going to be with the voters.
Yeah, I think that Assemblymember Burke certainly raised some of the opposition arguments that we typically hear about taxes, about how it's going to disrupt the current system, and how workers who get union bargain benefits, right, will be affected, and how others in the insurance industry will lose their jobs. But the truth is that collective bargaining over healthcare benefits is a no-win situation. Those benefits get worse every time. The takeaways are severe. In fact, workers make less money in wages because all the increases that they can negotiate from the employer go to pay health insurance premiums. And the truth is that the pandemic exposed just how unreliable and scary an employment-based insurance system is. So that doesn't have much saliency. AB 1400, like other single payer proposals, has a program for economic security, job training, and other provisions to protect those workers who will lose their jobs. The truth is that those objections and the cost objection are red herrings. And this is a system, I remember, like, the California Republicans came out and said, oh my God, the Senate Appropriations Committee says that the healthcare, that single payer is going to cost $400 billion. Well, guess what? This year it costs more like $430 billion. How does $638 billion sound to you? Because that's what the UC Berkeley Labor Center says healthcare in California is going to cost in 2031. So that's the context in which this happens. And I think that our ability to speak directly, as you and Maureen have said, we got to tell folks exactly what it's going to cost them and how they are going to be better off, even if they end up paying public taxes instead of the burdens that they currently suffer under. So ultimately, we're going to have to win that message war, or we're not going to win the fight. Now, is Assemblymember Holden going to hold up this bill? Appropriations is usually a committee that is controlled by the Speaker. So generally, the Speaker, gives a signal as to which bills are ready to go to the floor. The main issue for AB 1400 that Assemblymember Kalra will have to address is, does he have the votes to win the floor fight? He doesn't want to go to the floor unless he has the votes in his pocket to win. That's another reason why it may be held in appropriations to the last minute, because there'll be an effort to secure the 41 votes they need to move it. So it's a very fluid situation. I don't think necessarily the chair of that committee is the power broker here, but he may reflect the corporate Dem caucus opposition, right? And it may be because we've lost some key sponsors like Lorena Gonzalez and David Chu, because those seats are now vacant. It might be very tight. Are there enough progressives in the assembly to vote it out and get the 41 votes?
Yeah, I think I just read that Lorena Gonzalez went on to be the head of the SEIU. Is that correct?
No, the State Labor Federation, the California Labor Federation, as of July. She's apprenticing with the current Secretary Treasurer, Art Pulaski, and is expected to take over in July and has resigned her assembly seat.
Well, she could help from that perch also.
Exactly. And there are a lot of folks who think that will be a crucial, particularly if we're going to the ballot, we're going to need every ounce of the Labor Federation's support.
And David Chu went to be what, city attorney?
City attorney in San Francisco. Yeah.
Okay, so you make a lot of sense. Holden probably is not doesn't have any power. It's going to be, but let's talk about the governor right now, because I remember thinking, and Michael, you were intimately involved with this decision, I'm sure, for the nurses to endorse him like almost 2 years before the election, and before anybody else had thrown their hat in the ring. And I believe, and you can tell me if I'm wrong, the calculation was that if you put your weight behind him and he knew that you wanted single payer, that he would be the champion for single payer. And then, of course, he gets elected and he doesn't do anything for it. In fact, he appoints a commission, which everybody knows is a classic stalling tactic. When you don't want to take action, you appoint a commission. Now, you told me earlier in the pre-interview that it was really Jerry Brown and Rendon that did the commission, and it was for universal health care. And then Gavin Newsom expanded it. But he expanded it. I mean, most of the people were not for single payer, because I remember being on the Zoom calls, their early meetings, and there were only a couple of advocates for single payer. I'm sure you were on those calls too, Maureen. I remember you were calling that, say that committee was illegitimate. I disagreed with you because I thought we needed to really, work with them. And I remember when the FCC, I don't know if you guys remember the net neutrality fight, but that was another issue I was working for. One of the commissioners, I forget his name right now, he went out and he held separate hearings around the country, because the commissioner, Tom Wheeler, was an FCC, he was a Verizon lobbyist before he was, made head of the FCC by Obama. So this commissioner, whose name escapes me, was a hero to our movement, because he had hearings all over the country for net neutrality. And I was saying in those Zoom calls, that's maybe what Carmen Costi should have done, and some of the others. They should have held their own little listening tours around the state and invited people to come in and share their healthcare stories to kind of create support, because that's how I think like an organizer. But maybe you can talk about that commission, because I know you have more favorable views towards it, Michael.
Well, I think here, we should all be skeptical, and Maureen was right to be skeptical as it unfolded. But then what happened was Secretary Galley, who's the Secretary of Health and Human Services in California, took over as chair. And since then, there has been a real evolution in the committee. Keep in mind that Jim Wood is ex officio on that commission and voted for AB 1400.
Yeah.
And if you had asked us 8 months ago, what's Jim Wood's position on single payer, I think we'd all have agreed he's he's against it. And he is no longer against it, in part because what's presented at that commission, they've shown the present system is unsustainable, too costly, has huge gaps when it comes to mental health, in particular, other healthcare services, long-term care. The copays and deductibles are very onerous, and that the models out there that we've tried have left huge gaps, and that, as the UC Berkeley study I mentioned earlier showed, we're going to spend hundreds of billions of dollars more under the present system if we do nothing, and we still won't necessarily cover everybody because those gaps will remain even if they have coverage. And there's been concerns over how Medi-Cal doesn't adequately cover. There's surveys. Go check that website out now. You'll see surveys of the commissioners who indicate that, yeah, they're supportive of a plan that gets us to unified financing, their term for single payer. So it has evolved, and I think it's evolved because of the substance of the presentation. And I would much rather have that context to say the official commission set up by the legislature and the governor has concluded that the present system is unsustainable and that single payer financing will cost us less and improve our healthcare. Imagine introducing ACA 11 in that context. And that's really what I think our job is if that report does come out favorably, based upon what the commissioners have heard, it should, then we should use that framing, that context. And also, I think we should understand that the governor has got the chair of the commission as his staff person. He appointed 5 members of that commission, including 2 of the single payer proponents, Dr. Rupa Myra and Carmen Comsty from CNA. So he appointed those single payer appointees. And absolutely, we endorsed Gavin Newsom because we expected him to do single payer, unlike Arnold Schwarzenegger, unlike Gray Davis, who did some other very good things, certainly unlike Pete Wilson, and unlike Jerry Brown. And he ran on and had supported 562 explicitly. We still expect him to keep that promise. And as great as Health for All is, expanding coverage to undocumented workers, it's not in opposition to single payer. It's the single payer is the next step. Once we cover everybody, let's close the gaps, create a sustainable system, and lower costs.
Right. So who do you think, Maureen, did you want to add something?
Yeah, I have a different view of the commission, and that is that the governor had 8 appointments. Yes, 2 are definitely single payer, possibly 3, and several of the appointees actually are working with foundations, which really their source of their funding is the insurance industry. In addition, Dr. Galley, one of his main consultants is Carmela Coyle of the California Hospital Association. She is also one of Governor Newsom's main consultants. And she has definitely been working against labor in the hospitals. And the influence, the California Hospital Association makes billions of dollars. I mean, the hospitals have made a few $1 billion during the pandemic and before. So I think this influence is troubling. Also, the commission, the documents, there was a lot of concern at the beginning, both Rupa and oh God, I'm blanking my name, but anyway, Rupa brought up in particular, Carmen Comsty, that they felt that the way that the information was collected from the commissioners wasn't really fair. It was individually. They didn't really meet in between the meetings. The documents were provided by Mulkey Consulting, and Marian Mulkey sat on Insure the Uninsured project as she's the chair of that now, which is an industry an industry group that wants to keep insurance in the system, for-profit insurance. So that was kind of troubling because Mulkey Consulting provided the documents also for the Assembly Council on Health as well. And not just provide the documents, but, that really directs like the research and the narrative. And there was a lot of concern about that originally. Yep. I'm not
Well,
sure that the commission has changed. I mean, Michael feels it has, but
well,
Well,
you
yes,
got
we'll
to
see.
admit, Maureen, Jim Wood's position certainly has changed.
yes, yes,
He
but,
voted for AB
yes,
1400.
absolutely. But I
Yeah.
don't necessarily credit the commission. I will tell you that on the grassroots level, these fabulous activists up in Humboldt and Eureka have been visiting him. He's been getting letters. He's been getting phone calls. I'm very cynical, but I still believe that legislators getting pressure from their constituents might make a difference. And I
Absolutely.
think people have done
Yeah.
a very good job. This is a very different situation from 2017. People have more people are suffering. Costs have gone up. Employees, have lost their jobs and lost their health insurance. People like my sister, who taught disabled adults for 17 years, suddenly she's on COBRA, which is not it's not affordable. So I think all the statistics are worse than they were for people. There's more suffering, and I think so more people are paying attention. And also we have recorded Gavin Newsom's his comments. Like, I have a few of them here. I'm tired of politicians saying they support single payer, but that it's too soon, too expensive, or someone else's problem. He said, it's time for a new approach. Single payer offers a simpler, more effective, more cost-effective approach to healthcare delivery in California. I've been dealing with naysayers and cynics my entire life. The only limits on what California can achieve are our will and our imagination. So I think if we can continue to encourage Governor Newsom to be honest, what can I say? Be true to his words. And I think the grassroots, there's much more of a grassroots movement now. I do. And yeah.
Well, we know that the federal government is not doing this for us, because we saw that not only did Biden not support Medicare for all when he was a candidate, he supported the public option. He dropped the public option right away, almost as soon as Obama dropped it. But at least Obama dropped it because he was negotiating with the insurance companies and the hospital companies for the ACA. Biden dropped it for no reason at all. And then, of course, we had Bernie with the Build Back Better bill, just trying to expand Medicare and get it to include dental, vision, and hearing aids, and also to negotiate with Big Pharma. And all that was taken out. I mean, it got whittled down to like giving seniors, what, $800 for a hearing aid? I mean, it was a joke. And President Manchin, made sure that that's not going to pass. So everything really depends on California. And everybody says that, it's like Canada, where it started in one province, Saskatchewan. And if we can show it here, we're the 5th largest economy in the world. And if we can show that it works here, then we can really be the bellwether for the rest of the nation.
I wanted to say something about the unions, if I may.
Yeah.
The unions would do so much better with AB 1400. We talk about job loss. More jobs will be gained. When you think about it, one of the things that AB 1400 has in it, it's restorative. It has extra funds for areas like rural areas and urban areas that have become healthcare deserts, where people really don't have access to care anymore. And that's because of, the consolidation and the corporate buyouts of these hospitals going bankrupt because they're in poor communities, and the people that use them are either uninsured or they have, Medi-Cal, which doesn't pay enough. So when you think about everything a hospital needs, right? AB 1400 has a pledge to fund building, construction, and refurbishing of hospitals in these healthcare deserts, and these places that have suffered from so much discrimination in the past and have been disabled by lack of funding. When you think about what a hospital needs, they need electricians, they need plumbers, they need IT people, they need janitors, they need food service people. I mean, when you think about that, South Central LA, has become a healthcare desert as well. So many of the clinics have closed. So when you think about when you start investing, AB 1400 is an investment in people, and it's our money. Those are our tax dollars up there in Sacramento, and we want them invested in us. The insurance system is an extraction. So we don't want to have any little, I remember Michael Lighty during SB 562 said, no incrementalism. It's not, we're going to get to it. We're going to piecemeal it. We're just going to do it, right? Because otherwise it doesn't work. So I feel like that part is being lost in the conversation, and not just the hospitals and the facilities and the clinics, but think about wherever there are hospitals, what businesses grow up around a hospital, right? You're going to have an infusion in the economy. As Paul Wellstone used to say, we all do better when we all do better.
Yeah.
And I
think he got that from Jim Hightower, though. I don't know.
Jim
but
Hightower.
But I'll say this:
Okay.
what we saw last week with the introduction of ACA 11 is that this is not an overnight process, right? We got to pass a bill. What AB 1400 ultimately does is open up negotiations with the federal government. If the federal government says we like that, we don't like that, then the bill changes. And then it has to go back to both houses, and we have to put in the financing from the feds. Then we have to either pass that from both houses, or they put it on the ballot, or we put it on the ballot. And I agree that the grassroots effort with Jim Wood, we helped, Healthy California now helped on the grassroots effort with Jim Wood. So I totally agree, Maureen, that's key. But the institutional support of the unions, and we have got to convince their membership and their leadership of what you say, that they're going to do better, that they right now believe that they have a great deal of control over how health benefits get negotiated. Ultimately, it's a transfer of money from the employer to the insurance company, and that does workers no good in now and in the long run. And so we've got to make the case for why that is. And I think we can, but we're going to have to build that institutional support, not just the grassroots support, I think.
Well, you know who we can use? We can use the Culinary Workers Union in Nevada, because I think you remember, Michael, working
I was there, yes, debating them, yes, in
Bernie
2020.
2020. Their union leaders did not support Bernie because of single payer. They were very proud of the health care they negotiated with the casinos. And fortunately for us, I say that night when Bernie won the caucus was the last night I was hopeful about national politics. It was a wonderful night. You were probably there in that bar, Michael. But fortunately,
Bar? What bar?
Bar?
Everybody was there.
Ballet.
But the rank and file, they didn't listen to their union leaders, and they supported Bernie, and they were proven right, because as soon as the pandemic happened, they were all laid off and they all lost that great insurance. So
to their credit, the Culinary Fund did maintain people's health benefits. They ran their clinics and so forth, but at great cost. And ultimately it required federal support, as you say. And so I think a lot of those members were as concerned about their friends and family, right, as they were about themselves. And I think that's generally true. A lot of union members think they got a pretty good deal, and relative to others, they do. But what about, even folks on Medicare? 11% of seniors couldn't afford the care they needed last year. Under Medicare, the privatization of Medicare.
Oh, yeah, I'm going to do a whole show about that. And Biden is continuing this Trump policy.
Exactly.
To transfer people sort of without their knowledge into these, what is the term? Direct
contracting entities, yeah. And AB 1400 fills the gaps in Medicare. If we can integrate it all to the good, if we can't, we're going to be able to fill those gaps. So I think it's quite extraordinary. And as Maureen, as you said, I'm just going to say, as Maureen said, what happens under AB 1400, like other single payer bills, is that the capital budget that now goes to their concierge services and their hospital expansions for greater revenue and profit, and their national expansion in the case of Kaiser, will instead be controlled by the single payer trust fund, the CalCare trust fund in this case, and those monies will be allocated based upon community need. That's the fundamental difference. Rural hospitals close not. That's the big thing we were talking about in 2020. Oh, rural hospitals are going to close under single payer. Well, no, they're closing under the present system
Yeah,
because they're not profitable.
right.
And we have a program that will keep them open and expand them.
Yeah, we have
Michael,
that.
I have a question. I have a question for Michael. May I ask it, Lauren?
Sure.
Under SB 562, since I followed everything you said and did and used your models for anything I had to say, you did mention that there was the possibility that for the GAN for Prop 98, that in fact, if the money doesn't go into the general fund, it goes into a trust fund. So that maybe Prop 98, I mean, that's something debatable, as everything is. Maybe Prop 98 doesn't really apply if the money goes into a trust fund and not into the general fund.
Well, right. And so what CalCare does is say it still goes into a trust fund, but we've decided that we're still going to get voter approval. We were working on a legal theory that said you didn't have to do that. And it is controversial. I'm not saying it was a broadly accepted notion. The easier path is to say, yes, we're going to put it in that segregated fund and we're still going to get voter approval. Is it necessary? That's where the debate lies. The fact is, though, is that even if we didn't put it on the ballot, the industry probably would. Like if we passed this to the legislature, like they did with SB 2, they would just put it on the ballot as a proposition and we'd have the ballot fight anyway. So it's kind of 6-1, but I think that there is certainly a case to be made that it's not actually going into the general fund. And those provisions, GAN and 98, only apply to the general fund.
Mm-hmm.
And you see other things. You see when we had that huge budget surplus this current fiscal year, they found other funds to put that money in that they claimed exempted them from GAN.
Okay, I want to go back to the politics a little bit because a viewer posted here a question that I was going to ask you, and that is, can you please discuss how Newsom could have planned to sabotage 1400 by introducing his undocumented budget item and mislabeling it universal, which was announced at the hearing last night that he's going to make it so all undocumented immigrants, it used to be just kids under 26, but now all undocumented immigrants can access Medicaid. And excuse me, she mentions that two of the corporate Dems referred to it as a reason that we don't need AB 1400, and that it was kind of suspicious. This was in the chat that this was introduced at the same time this bill started to go through its hearings. What is your thinking on that, Michael?
Well, I think one is just the budget, right? And the budget is at the same time as the AB 1400 hearings. So if he's going to support what's called health for all, he has to put it in the budget. And so, yes, it is coincidental. And it does. His messaging was problematic because universal access is not guaranteed health care, and coverage is not care. And yet, at the same time, as advocates for guaranteed health care, we welcome undocumented folks being included. It's a hot button political issue. Yet, it is, of course, the morally and policy correct move. We're only as healthy as the person sitting next to us or standing in line next to us at the drugstore, as we've learned from COVID, right?
Yeah.
So obviously everyone needs to have healthcare, and even under Medi-Cal, which is after all, a publicly financed program, inadequate though it is, it's better than not having insurance at all. And so yeah, let's accept that. These are not counterposed. And I think that's where some of the rhetoric we're hearing suggests that it is. Oh, we've already got universal coverage, universal access. Yeah, universal coverage that preserves the private profits, the profiteering, the high out-of-pocket expenses for workers, the, lack of wage increases because it's going to health insurance companies, the waste, all the fragmentation, the inefficiencies. Yeah, we have universal coverage and we have all that, and we're going to spend $638 billion in 2031. We eliminate all that. We still have universality, but it's guaranteed health care without those copays and barriers to care. That's the case we have to make.
Yeah.
And I think there is a fight to be had over whether the governor can, say that this is universal access, and that's sufficient. It's not the same thing. And as advocates, we got to point that out. Hopefully, my version of the commission is it comes more to fruition than Maureen's, and we can use what they find. If not, then we have a different fight too. But it's not like the fight's going away, and it's not going to be over this year, no matter what.
Okay, we've reached the end of our hour, but I want to talk about the most important thing, which is what viewers can do. And I would like to think that what we're asking right now is for every single viewer, and I imagine they have to be California residents in order to count, but they should call the members of the Appropriations Committee, which I will put their names and numbers into the comments, maybe within the hour after the show is done. And they should tell them that they want them to vote for, this bill. And I think they should also call their own representative, whoever it is, because at some point it's going to be going to the General Assembly, hopefully, if it gets through these committees. So after appropriations, where does it go, Michael?
It goes to the floor. But see, that's why I would say if there's a majority for it, if there are 41 votes, solid 41 votes for it, there's no reason for appropriations to hold it. And the momentum not to hold it in appropriations will be there. So that's really what we got. That's the task before, folks, is getting the 41 votes secured so that the appropriations can't hold it up, that there's a majority demanding it, and they got to give that majority voice.
So that everybody should also call their representatives right away, because they could be part of those 41.
That's right. And that's time is of the essence, because it's got to pass appropriations by January 21st. And then it passes the floor by January 31st.
Wow. Now, why is that? Because my understanding with a 2-year season is the end of the legislature is always in August.
Not for a bill that started, it is true that 2-year session lasts that long, but the bill has to make progress during that 2-year session in order to still be live at the end. And in a 2-year bill has to be heard by its first policy committee by the January 14th in this case, right? And if it doesn't, then it is no longer live for that session. Then it's got to get out of appropriations by January 21st, and it's got to pass its first House of Origin by January 31st. So because it's a 2-year bill, the alternative basically was back in June when it didn't move at all, is to say, okay, fine, that's it for the year. But instead they converted it to a 2-year bill, and then it has to meet these deadlines to move forward.
So then does it go to the Senate and that
Yes.
process finishes in August?
Yeah, depending on, it has certain deadlines to meet there. It's got to get out of a policy committee. A policy committee, by the way, which is chaired by Richard Pan, whose views on the commission have not changed
Yeah.
towards single payer, I think it's fair to say.
Yeah.
So yeah, there are obstacles in the Senate as well. Then it would be signed by the governor, but that has to happen. I think it has to pass that policy committee in July, and then if it continues on by the end of August, pass the Senate.
Now, let me ask you a question as an organizer. There are a lot of organizations who have endorsed this bill. I mean, they started naming them. A lot of them called in, the other night. Big numbers, the Los Angeles Democratic Party, the Los Angeles County Fed, Courage California, the California Teachers Association. All of these organizations represent millions of members. Do either of you know if these organizations are in the process of sending emails to those millions of members, instructing them to call their representative for this bill? Because in my opinion, what is the use of endorsing something unless you actually, lobby for it? You get your members to lobby for it.
Right. So Healthy California Now is putting that out in our email list, how to contact their assembly members, and urging folks to do that. I don't know of, and I know all of the affiliates are, and certainly the nurses campaign has been very effective at that, so they're getting the word out. And I know like Healthcare for All LA and DSA and other organizations are. So but yeah, there's a question: is CTA mobilizing its membership? We haven't seen that so far. And it is going to be important, but really ultimately as important as that, I still think, is the union making it a priority in their communications, that institutionally they weigh in. That's what we need. That's where again Governor Newsom was right. It's like, yeah, everyone says they support single payer, but how are they actually going to do it? And now that burden is on him, I think.
All right.
I'm wondering, I'd like to know, Michael, what you think about, and if this happened with SB 562, because I don't remember that it did or didn't. California Democratic Party endorses AB 1400. That's 10 million people. And when you talk about unions, we have 39 million people in the state of California. There are 2.5 million union members. That's it. And when you look at them, like CTA is 300,000 and nurses is 100,000. And I mean, these unions have a lot of members. So, but I'm wondering, I mean, it would seem to me if these are Democrats, the Democratic Party of 10 million people should hold some kind of sway with them. What in SB 562 did this?
Yeah, they did. They did. Oh
Okay.
yeah. Oh yeah. And they do all the time.
They do all the time. Okay.
Look at the party, right?
The county party, I will say, the county party has had panels. The county
party's done a lot.
LA County, which is
Yeah.
3.5 million people.
Yeah.
3.5 million members.
Which is good.
They have been doing the work.
And that's where this is going to be decided. Ultimately, you get a big margin in LA County on the ballot and you win, right? So that's not nothing. And that's what the party offers, is that ability, I think, to do that kind of campaign.
LA County is the largest Democratic party in the country.
Right,
LA
exactly.
County.
It's the largest county in the country. So it's really a question of the unions have disproportionate power. Look at New York State. A majority of the Assembly and Senate in New York State co-sponsored the single-payer bill, and public sector unions were able to prevent it from coming to a vote. So the institutional power of these organizations, now that's true of the California Medical Association and the California Healthcare Association, known as the Corporate Hospital Front Group. And those are very powerful institutional players, and we've got to make sure that it's clear that they don't represent patient care, that our movement represents patient care, the nurses represent patient care, right? Not these institutional interests who have a name, but actually act in their corporate benefactors' interest.
It seems to me we have to change what power is. Is power just going to be money? If it's all about money, we lose all the time.
Mm-hmm.
We don't have the carrots. We have some sticks.
Yeah, I also,
and that's why electorally,
we have people
you're right.
power. And
right.
Also, this is bigger than this one issue. This is about democracy. Are we going to be represented or not?
Right.
Are we going to have legislators who actually take our money and spend it on us in the way that we need and listen to us, or not? And if not, we don't have a democracy. So we have got to fight
all the money
for democracy.
Right.
There's something else people can do. And, Betty Dumas Chodo was talking to me about this earlier on the phone this evening. Jesse Gabriel, who is a newly elected representative from the San Fernando Valley, probably her representative. They had a citizen lobby meeting with him on Zoom. And it's a lot easier to do this now on Zoom. You get more people participate. And if you want to take the extra step to just calling your representative, you can get a group of people together. And if you have some personal healthcare stories, it always helps. And try to see if you can schedule such a meeting in the next few weeks before the 31st.
Before the 31st, yeah, definitely.
Yeah.
They're doing that up here in Silicon Valley as well. So
yeah. And the other thing that I want to say, just one more point about organizing, is when they start their deceptive advertising, the only thing that is going to counteract that is door-to-door canvassing. Because I remember when there was a ballot initiative to have a moratorium on new fracking in Santa Barbara, I went up there with Food and Water Watch and a bunch of other groups. We went door to door, and I spoke to a Latino single mom who was telling me that she was going to vote against it because she was worried about all those poor oil workers that were going to lose their jobs. And I had to tell her, no, that's not true. The moratorium was only on new fracking. Nobody was going to lose their jobs. And so I really feel that these car caravans and everything that they're doing, they're very nice, but they're not the same as these one-on-one conversations that are going to need to be had at the door. So now, if anybody wants to say a closing comment, I think we've reached the end of our show. I just want to tell people to please share the show. My audience has diminished very much during the pandemic because everybody and their uncle is doing Zoom now. Every organization is doing a show. You know, there's so much competition for eyeballs. I used to get thousands of viewers. Now I barely get hundreds of viewers. But this is a super important show and everybody should share it. And if you're in a Facebook group, please share it with the group and let people know in your status post that there's a time sensitivity to this. So I'll leave the last words to you two.
Well, I
Maureen,
was
go
just going
ahead.
to say, we don't have the corporate billions to spend, but we do have two things. We have the truth, and the truth is people are only going to gain. They're not going to lose anything with single payer, and they're not going to lose anything with AB 1400. And that was a comment that was made by a few of the assembly members in the health committee, that they're going to lose. Nobody loses anything except you lose getting a bill sent to you that you can't afford and that you have to go into medical debt for. So it's a gain. Everyone gains. And so we have truth and we have people. And those are the tools that we're going to have to use. Is the truth. Just keep promoting the truth and use people. And I agree with you. Door-to-door canvassing is a very good idea, but it's kind of hard during the pandemic.
I mean, it's how Bernie won California.
Yeah.
In
Well,
2020.
I've been doing door-to-door, and because a few of the candidates have that we endorse also let us do AB 1400. We do that in combination with working for them. So
Well, hopefully by the time this ballot initiative is on, the pandemic will be over, or at least it'll have turned into an endemic, not a pandemic.
Right. I think that there's no question that people power is going to be behind this campaign. I think it's also true we're not going to win a ballot initiative in California without being able to compete on TV. That's just the way it is. And so we are going to figure out how to, get the resources to do that. And I think also that it's a political question. We've got to elect people or unelect people on this issue. So if there's someone, say, in Los Angeles who doesn't support AB 1400 and there's a challenger to him in a Democratic primary, well, she should win, for example.
She will.
She will. And someone like Pilar Chiava, who's running in a district currently represented by a Republican, who's one of the great single payer organizers in California, she needs to be in the assembly, just like David Campos needs to be in the assembly from San Francisco. So these electoral victories matter. I think building that institutional support matter, doing the long-term education and inoculation campaigns matter, and all of it is going to be necessary. It's not like we can afford to just do one thing here. We're going to have to do all of it, and we're going to have to maintain committed, and I think we got some momentum, so that's a good thing.
Well, I may not live in California anymore, but I lived there for 33 years and I still support the causes and all you guys, and I'll help as much as I can.
Thank you, Lauren, so much.
Lauren.
This helps. Thank you.
So on that note, I want to say thanks everybody for watching. Please share this show and keep fighting.
Yes, in solidarity. Bye, everybody.